Hi everyone, thank you for watching our presentation on acupuncture and how it relates to the Chinese culture. We are group 3 and it is Olivia, Mara, Sabrina, Sophia, and Noah.
Acupuncture has become a more common and well-known practice in America and is even becoming more integrated into modern Western medicine. This is extremely beneficial as studies show acupuncture's effectiveness in treating multiple illnesses without the side effects that come along with pharmacological medication treatment. Acupuncture is a non-invasive medical treatment that is performed by a trained acupuncturist. The acupuncturist inserts a fine, sterile needle painlessly into the top of the skin, with the needle only going about a quarter or half inch into the skin. When the needle is inserted, it is inserted into a meridian point, which I'll talk about more in the next slide. The body reacts to this stimulation by releasing a multitude of nervous system chemicals that activates the body's innate healing abilities. This practice dates back to 2600 BCE and has been effective for many people and cultures over the years. Acupuncture is a type of traditional Chinese medicine. This perspective sees acupuncture as working by balancing qi, the vital energy that animates the body and protects it from illness. When qi is unbalanced in the body, illness occurs. Acupuncture is the practice of balancing the body's qi and yin and yang to restore the body to homeostasis and maximum health. The modern medical perspective explains acupuncture as being effective because the stimulation of acupuncture points causes the release of a multitude of nervous system chemicals in our brain, spinal cord, and muscles that help restore the body's ability to heal naturally. Both the scientific and holistic perspectives agree that the purpose of acupuncture is to restore the body to health, well-being, and homeostasis. Qi, the body's vital energy, is thought to flow through the body through specific pathways in the body called meridians. Each meridian is connected to specific organs and glands, as you can see in the picture included in this slide. Meridian points are along the meridian pathways, and by stimulating these points through needle punctures, it balances the flow of qi and degrades blockages. As I mentioned before, acupuncture is a type of traditional Chinese medicine that dates back to thousands of years ago. We know this because of the traditional Chinese medical text called the Yellow Emperor's Classic of Internal Medicine that dates back to 2600 BCE. Through the years, acupuncture developed into how it is more commonly used today, which was established during the Ming Dynasty. Acupuncture is still a primary medical treatment in Chinese culture today, and is integrated into the Chinese medical system more than any other country in the world. The concept of acupuncture in Chinese traditional medicine was brought to America in 1972 by President Nixon after he fell ill during a trip to China. He was successfully treated with acupuncture and was excited to introduce it to the American medical system. The introduction of traditional Chinese medicine to Americans was met with a lot of resistance, but has become more popular over time and was acknowledged by the FDA in 1995. Acupuncture has continued to become more popular in the West over the last 40 years due to scientific studies that prove the effectiveness of acupuncture in traditional Chinese medicine.
Just as Sophie said, acupuncture is the insertion of fine needles into various pressure points called meridians into the human body to relieve various pains such as chronic pain. That would include joint and muscle pain. So within the traditional Chinese medicine, they categorize their 4 main medical treatments by the energy it treats. Most people are familiar with the yin and yang theory, which they must work in equilibrium to maintain the balance of dynamic growth and decline within an individual's life. The other equilibrium balance that we must maintain is qi and blood. Qi is an energetic essence that aids in forming the human body and maintains normal daily functioning of the energy it needs. Blood is seen as a nourishing nutrient that runs throughout the body's veins. So just as yin and yang must maintain equilibrium, so do blood and qi. Qi and blood can transform into each other, so an imbalance of either of these will cause an imbalance in the other. They connect each other into the human body by allowing qi and blood to get to various organs and body surfaces. A blood insufficiency will cause a qi insufficiency, which can cause mental diminishment, forgetfulness, irritability, insomnia, and many other negative symptoms. Acupuncture is seen to maintain this equilibrium and balance of qi and blood. So the uses of acupuncture in modern society are still surrounded upon this traditional Chinese theory. Whether people believe or practice this traditional Chinese theory or not, that is how acupuncture is proven to be effective. Acupuncture is seen to cure many chronic pains and illnesses, but it also can be used prophylactically in modern medicine. Modern medicine is surrounded upon the idea of treating sickness before we get sick, and that's also how acupuncture is used in modern society. So if we maintain regular periods of acupuncture appointments and treatments, we can maintain this internal immune stimulation to fight off sicknesses. The most common uses in Chinese culture today are for health promotion, just like I stated, anxiety, depression, menstruation, headache, fatigue, and stress. Many traditional Chinese medicine practitioners will use acupuncture in combination with herbal tea, and that's because acupuncture will increase the energy and reduce the stress in the human body, while herbal tea will rid the bacteria and mucus that makes a person sick. So acupuncture is a non-pharmacological way to prevent illness, pain, and injury, and can be used prophylactically to maintain wellness and overall well-being in the human. Since acupuncture has been around for thousands of years, there's a lot of research out there about various diseases, injuries, sicknesses, and pain that acupuncture has been proven to be effective for. There are 4 main categories that has been proven to be effective for. It does create an analgesia effect, which is pain relief, in both acute and chronic pain. Most of the research that's done is done to prove its effectiveness about helping chronic pain. It also has an anti-inflammatory effect, both locally and systemically. It also lessens anxiety and stress from various conditions, diseases, or procedures. It provides an immune response defense when somebody is actively ill and prophylactically. With chemo-induced or procedural-induced nausea and vomiting, acupuncture has been effective for decreasing the stimulation to vomit and the act of vomiting. Although most of the research conducted is about chronic pain, there are various conditions causing acute pain that acupuncture has been proven to be effective for. This includes dental pain, various headaches, migraines, labor pain, neck pain, and various joint disorders. It helps with acute pain because the brain becomes consumed on the stimulation of these pinpoint needles that it redirects its focus from your acute pain to the acupuncture treatment. Its effectiveness is surrounded upon chronic pain. It is extremely effective because of a lot of the times chronic pain is not receptive to pain medication such as opioids. So with this acupuncture treatment, it actually takes away the pain for these people. People who experience chronic pain never have pain relief. So during this acupuncture treatment, when they do feel some kind of pain relief, they are very hopeful that it's going to get better and that they can move on with their quality of life. A study was conducted to look at the Vermont Medicaid population who were older adults with various musculoskeletal chronic pain issues such as knee pain and back pain, and this study wished to compare the pain effectiveness with acupuncture treatments and opioid treatments. So long-term treatment of chronic musculoskeletal pain with opioid prescriptions does provide effective pain relief, but the side effects often outweigh the desired effect. So it does provide pain relief, which is what we want, but it also creates side effects of addiction and opioid-related overdose and death. And this is why the opioid pain epidemic is where it is now. So opioid prescriptions have quadrupled since 1999, as seen in the picture. There is 17,000 prescription opioid deaths annually, 80,000 NSAID and acetaminophen-related ER visits annually, and $635 billion is the annual economic cost of chronic pain. So we see that chronic pain is an issue in the U.S. healthcare system, and we're so free to write these prescriptions, but many times people do overdose and become addicted to these, leading to further issues. So this study really looked at the acupuncture effectiveness, and what happened was when acupuncture was used for treatment for various types of chronic pain, it resulted in significant improvements in all of these areas. improvements in physical, functional, psycho-emotional, and occupational outcomes. Patients reported that they had less pain and they felt more energized. They completed this study to potentially reduce the amount of opioid prescriptions written, which will then hopefully reduce and prevent further problems with opioid addiction, abuse, overdose, and death. Many non-pharmacological interventions, such as acupuncture, are alternatives to managing chronic pain, and this will decrease the dependence and abuse that we see with prescription medication. The promotion and education of acupuncture as a treatment modality will reduce the amount of opioid prescriptions written, reduce addiction and deaths related to overdose, which can combat this epidemic. We just have to become educated on the various treatments and become educated on how it works for our body and chronic pain.
Moving on to advantages of acupuncture. So acupuncture can treat a variety of conditions, and this includes migraines, tonsillectomy pain, osteoarthritis pain, neck and shoulder pain, sciatica, which is pain that radiates along the sciatic nerve, and that's usually caused by pressure being placed on that nerve. It can also treat depression, but it's usually used as an add-on treatment or in addition to other treatments such as with medications, and it can also treat insomnia. Another advantage is that it's much safer in comparison to other medical interventions. So as we've just seen in the previous slide, opioids can lead to death due to addiction and withdrawal symptoms, which makes opioids a much more severe form of treatment. In comparison, acupunctures produce barely any side effects, and if there are any side effects, they're very minimal, and those will be discussed in the next slide. One more advantage is that it's a much more cheaper, cost-effective in comparison to other medical interventions such as medications. Moving on to disadvantages of acupuncture, it can lead to several side effects, but they're usually not very severe. So you can see some minor bruising at the puncture site, some soreness. The patient might experience dizziness, nausea, or minor bleeding at the site. And if the patient's on any anticoagulants, such as heparin, Coumadin, or apixaban, this can really increase their bleeding risk since it's their blood thinners, and this is actually a contraindication to acupuncture. Another side effect is a risk of infection, but this risk is usually very low if the person that's doing the practice is competent and a certified acupuncture practitioner who utilizes sterile needles. And these days, single-use disposable needles are being used, which really helps minimize that risk of infection. Another disadvantage is that the treatment can easily become ineffective if the patient does not commit to being consistent with attending their acupuncture appointments. And this inconsistency to attending these appointments can be due to lack of transportation or for many other personal reasons. For cultural competence with acupuncture, it is important to remember that the main goal of cultural competency is to provide quality care to patients by tailoring and altering the care given in a way that meets the patient's differing needs and respects their uniqueness and cultural differences. Healthcare professionals must be very informed and knowledgeable on acupuncture to implement it properly, effectively, and safely into the patient's care. They must also understand the importance of cultural awareness and not assume the patient's cultural differences and preferences for their treatment. And they must also be aware of their own beliefs and recognize any existing bias. And if they do recognize any, they should get rid of that bias to prevent any prejudice. They must also assess for the patient's beliefs about their illness and their preferred healing traditions or methods used to prevent illness, and then integrate those methods into the care plan if there are no existing contraindications.
There are many different points of patient education and support for the practice of acupuncture. One important education point is the importance of researching the acupuncture procedure before deciding it is the right treatment for them. This research can include the cost and different types of procedures, and how many procedures it may take for the patient to gain relief from whatever symptoms they are seeking relief from. Also, research has shown that going into acupuncture procedures with a positive and hopeful attitude allows for better patient outcomes. So that is a very important point to point out to these patients. Another educational point is to ensure patients research the acupuncturist they are receiving treatment from prior to the treatment. It is important to verify with the certain medical professional that they practice hygienic treatment in regards to the needles. Disposable needles should be used, and there should be a new pack for every new patient. One needle may only be used for one puncture site, and the skin should be cleansed with alcohol prior to puncturing. Another point is that you should educate patients that acupuncture points are located all over the body, and not all use points will be close to their pain. They should not be alarmed if this is the case. Another point is that when heat or electrical impulses are added to the needles inserted, it is very important to lie as still as possible. Improper needle placement or movement of the patient may cause some soreness after the procedure, which is expected. If symptoms do not improve in a few weeks, acupuncture may not be the suitable treatment for you. It is important to explain to patients what to expect during and after the acupuncture procedure. During, the acupuncturist will tell the patient the planned spots for the procedure and whether any clothing needs to be removed. If so, they will give you a gown or a towel to allow the patient more comfort and privacy. You will then lie down on a padded table and the procedure will begin. Needle insertion is when the needles are inserted at varying depths in different spots of the body. Typically, patients have little to no discomfort, but as the needle reaches the correct depth, some mild aching may be felt, but is not always the case. Needle manipulation is when the provider may twirl or move the needles while in place. Also, heat or electrical impulses may be used to the needles while in place. And afterwards, needle removal. The needles will stay in typically for 10 to 20 minutes while the patient is lying completely still, and when they're removed, typically no discomfort is felt. After the procedure, some patients feel relaxed and calm, while some feel very energized. This is normal. Not all patients respond to acupuncture, and if symptoms do not improve in a few weeks, again, acupuncture may not be right for your certain symptoms.
When would healthcare providers utilize acupuncture? Patients with neck pain, lower back pain, headaches, osteoarthritis, and even hypertensive patients can all benefit from acupuncture. Studies show acupuncture can reduce chronic pain and swelling. A study in Taiwan just this spring found evidence that combined with antihypertensive medications, acupuncture can lower blood pressure. Acupuncture can also substitute for opioids. With the current opioid crisis, it has become more apparent than ever that physicians should not prescribe opioids so freewillingly. Acupuncture offers a non-pharmaceutical solution to pain. In the Escape Fire documentary film, which focuses on ways to improve our healthcare system, acupuncture provides relief for returning veterans without endangering them to the risks involved with developing an opioid addiction once they return home. In order to evaluate said interventions and the effectiveness of acupuncture treatment, a survey could be given that will document a patient's changing pain scale. Patients will be asked to complete the survey before and after beginning acupuncture treatment, and the results will be compared. The survey can also be used to discover how much a patient is spending on medications prior and after acupuncture treatment. Interviews with patients can be conducted to assess how a patient describes their own health before and after acupuncture treatment. During the interview, questions can be asked to assess a person's knowledge of acupuncture and find misconceptions that the public may have regarding the practice.
And these are our references. Thank you for watching.